This is Learning to Listen, Conversations for Change, and I'm your host, Joshua Sparrow at the Brazelton Touchpoint Center. To find out more about the Brazelton Touchpoint Center and Learning to Listen, just go to brazeltontouchpoints.org and click on Learn with Us and look for Learning to Listen in the Conversations section. There's also a link there to our archive of Learning to Listen conversations over the years. To learn more about and register for more Brazelton Touchpoint Center conversations, events, and trainings, click on the link in the chat. To join the Brazelton Touchpoint Center's Learning Network, look for that link in the chat. Thank you all for joining us. Today, we will be learning about IVF, that's in vitro fertilization, and how IVF helps people become parents with Dr. Samuel Pang, board-certified OBGYN, reproductive endocrinologist, and head of third-party reproduction at Boston IVF. In a moment, you'll hear why his work matters so much to so many. We will also be joined by Larry Galbraith and Brian Barkwell, who will share with us the story of how Dr. Pang helped them become parents. But first, a bit of information about today's Learning to Listen episode. Almost 700 of us have registered for today's webinar. Please do feel free to tell us about you, where you're from, and what you do in the chat. It's great to see so many of you from all over the country. Today, our wonderful interpreter, Maria Jose Gutierrez, joining us from Bogota, Colombia, will be simultaneously translating our webinar into Spanish. Thank you so much, as always, Maria Jose. To access the translation, click on the interpretation icon in your Zoom controls. Then select Spanish. To mute the English in the background, select Mute Original Audio. La conversación de hoy será en español y inglés. En los controles de esa reunión, haga clic en Interpretación. Haga clic en el idioma que le gustaría escuchar. Para escuchar solo español, haga clic en Silenciar audio original. To turn on closed captioning, just click on the closed caption icon in your Zoom controls and select Show Subtitle. You can adjust the size of the subtitles. Please use the chat feature if you have a comment to share or need help with a technical issue. And please put your questions for Dr. Pang and Larry Galbraith and Brian Barkwell in the Q&A box. If you would like to receive a certificate of attendance for today's webinar, please be sure you complete the feedback survey. That survey will open in your web browser when this webinar ends. You will also receive a link to that same survey tomorrow in our thank you email to you. Before we begin, I want to thank our sponsors, the Burke Foundation, Cambridge Trust, and Berkshire Bank, and our Brazelton Touchpoint Center production team, Isabella Matija, Michael Accardi, and Suzanne Okasik. And now let me introduce to you today's guests, Dr. Samuel Pang and Larry Galbraith and Brian Barkwell. Dr. Samuel Pang is a board-certified OBGYN and reproductive endocrinologist at Boston IVF. In 1998, he became one of the first physicians to provide reproductive care to the LGBTQ+ community. His pioneering work has led to numerous advances and earned him the prestigious Arnold P. Gold Foundation Humanism in Medicine Award for practicing physicians in 2022. Dr. Pang is known and loved for his meticulous attention to detail in patient care and his respectful, empathic, sensitive, and compassionate way of being with patients, engendering their trust and confidence. Brian Barkwell is a physical therapist and owner of Work It Out Physical Therapy. For 20 years, Brian has helped more than 1,000 Boston residents rehabilitate themselves from pain, injury, and surgery. As the founder of his own physical therapy clinic in Boston, Brian focuses on one-on-one treatment for orthopedics, pre- and post-surgery, and the treatment of musicians. Larry Galbraith is Director of Alliance Management at Alnylam Pharmaceuticals, and as an experienced biotech professional with over 15 years of experience in the healthcare industry, Larry has played a key role in the clinical development and commercialization of numerous therapeutics for both rare and prevalent diseases. Larry and Brian are the proud parents of 2 children, ages 4 and 2, that were born through IVF and surrogacy with the help of Dr. Pang and Boston IVF. So Dr. Samuel Pang, Larry Galbraith, and Brian Barkwell, I want to thank you all so much for joining us today. And let's start at the beginning with you, Dr. Pang, and let's do some level setting. So please tell us basically what in vitro fertilization is, how it got started and when. And I know how extremely humble you are, but I hope you will also share with us your own pioneering role in vitro fertilization.
Thank you. Thank you very much for, first of all, thank you very much for inviting me to participate in this program and for the kind introduction. So to respond to your question, what is IVF? IVF stands for in vitro fertilization, and that is where we fertilize eggs and sperm outside the human body in a petri dish in the embryology lab, allow fertilized eggs to grow into embryos, and then transfer an embryo that has developed in the lab back into the uterus of a woman to allow that embryo to implant and result in a pregnancy. So IVF is something that was started back in the mid-70s. The pioneers were in England. Patrick Steptoe and Robert Edwards were the pioneers with IVF. They attempted IVF in many women unsuccessfully, but ultimately were successful. And in July 25, on July 25th of 1978, their first IVF baby, Louise Brown, was born in England. And since then, there have been an estimated probably over 14 million children in the world who have been born as a result of IVF. It's probably higher than that, but that was the last figure that I heard. So it got started primarily to help couples who had what we call tubal factor infertility, where the woman's fallopian tubes were blocked and she could not get pregnant. So the only way that we could get around blocked fallopian tubes was to do IVF. But over the next several years, once the technology was available, it became used for other reasons of infertility, such as people who had male factor infertility issues with the sperm, couples who had unexplained infertility, and eventually it was used to treat women who were of advanced reproductive age, who could not produce eggs that would result in successful pregnancy. And so that's how the concept of using donor eggs was introduced in the late 80s. So that was sort of the evolution of IVF up until then. Now, in terms of my involvement, I graduated from medical school in 1983, which was shortly after IVF was invented. And the first IVF baby in the US was born in December of 1981, Elizabeth Carr. And so during my residency, I learned residency in OBGYN. I learned about IVF, and it seemed like an exciting field. And so I applied for a fellowship. I ended up being accepted for a fellowship at UCLA in Los Angeles, California. and I did my fellowship training between 1988 and 1990. And when I completed my fellowship, I spent 3 years at a local university before moving to Boston in 1993, where I settled into a practice here and have been here ever since. So that's a brief summary of my own journey. In terms of my role in IVF, I was one of the very early physicians in the late 80s and early 90s when IVF was basically taking off. And so I was able to ride the wave. But the pioneering work was primarily with the LGBTQ community and providing care to the LGBTQ community. It actually started in around 1992, before I even moved to Boston. I met a gay male couple who asked how they could have children with donor egg and gestational surrogacy, and I explained to them that that had never been done before, but this is how it could be done theoretically. But at the time, I was not in a position to be able to help them because the IVF program that I was at was very strict and would not even treat heterosexual couples who were not married. So to treat a gay male couple would have been just not a possibility. But the couple that I counseled back in 1992 went on to find another IVF program locally in the Los Angeles area, and they eventually had 3 children with IVF and gestational surrogacy between, I think, in 1996 or 97. Myself, I was first approached by a gay male couple in 1998, and that was the first gay male couple I treated. And their children are already in college or have graduated college. And since then, I have treated, many gay male couples to help them. Prior to that, I was also treating lesbians with IUI. And about 12 years ago, I began treating transgender people who wanted to have children either through just IUI. I've had
Tell us what IUI stands for.
IUI stands for intrauterine insemination, where we simply inject donor sperm inside the woman or the person's uterus. So as I was saying, I was treating lesbians with IUI since the early 1990s. And in 2012, I believe, I treated my first transgender person, both for egg freezing before they transition. And I've also treated a transgender man who chose to carry a pregnancy himself, did IVF, and went on to carry 2 pregnancies himself. So that, in a nutshell, is the role I had in treating the LGBTQ community.
One other context that I'm not sure you mentioned, I believe, is women who have been treated for cancer prior to becoming pregnant and giving birth. So could you also tell us a little bit about that application for reproductive technologies?
Yes, so this reproductive technology has basically a very wide range of people that we have now been able to treat. And what I haven't mentioned, and you prompted me, was the treatment for people who have cancer. Historically, people who present with cancer, for example, breast cancer, testicular cancer, they would come and we would do IVF immediately and bank embryos. But more recently, with the egg freezing technology, we can now freeze eggs instead of freezing embryos. And the other major application for IVF is genetic diseases. So, for example, people who are carriers for a genetic disease or who have a genetic disease themselves. Examples are if both parents are carriers for cystic fibrosis or thalassemia or SMA, they can do IVF.
SMA is
Spinal muscular atrophy. Those are just some common examples of autosomal recessive genetic diseases that we can do IVF and test the embryos for which embryos are going to be affected and avoid transferring those embryos. And then there are autosomal dominant diseases such as Huntington's disease. There are also women who are carriers for the BRCA breast cancer genes that we can screen embryos for and avoid transferring those embryos to avoid perpetuating those genetic diseases to the next generation. Examples of the X-linked recessive genetic diseases are Fragile X, for example, or the Duchenne-Becker muscular dystrophy gene. Those are just a couple of examples of X-linked recessive genetic diseases that I've had patients for where we screen embryos to avoid having children affected with those diseases. So that's another application of IVF.
So for parents who are desperately wondering whether or not they should or shouldn't have children because they're worried about transmitting those kinds of conditions, you're able to help them make that decision and find their way, in some instances at least, and perhaps in many, to be able to become parents of children who do not carry the gene that they were worried about transmitting.
That is correct. As long as the gene is a gene that has been identified and is identifiable, we can help them. There are some genetic diseases where the gene has not been identified or a specific gene has not been identified as being responsible for that genetic disease, but we know that it's genetically transmitted. In those scenarios, we would not be able to help because we have not identified that specific gene.
Working on it. And in the context of cancer, correct me if I'm wrong, but the issue is that the treatments for cancer can interfere with fertility or have negative impacts on the eggs.
Yes, very frequently the chemotherapy and or the radiation treatment for cancer patients can damage the fertility potential. It can damage the function of the ovaries or the testicles. For men who have cancer, whether it be things like lymphoma or leukemia or testicular cancer, one of the things that they can do is to bank their sperm before they go through chemotherapy and radiation. For women, we can do egg freezing now. Historically, before we were doing egg freezing, we would have to go through IVF and create embryos and freeze the embryos. Now, if the women presenting with cancer were married or partnered, we could use their husband's or partner's sperm to create the embryos to freeze. But in women who were single and did not have a partner, historically, we would have to create embryos using just donor sperm from the sperm bank. And that was not ideal. It was an opportunity for her to bank embryos, but in a situation where she survived the cancer treatment and then went on to have a partner or get married, the embryos would have been created with, sperm from a sperm bank rather than her partner or husband.
And that's why.
But now we are able to freeze eggs that are unfertilized eggs, And so it's a different landscape.
Yeah. It's a beautiful thing to be able to help people who are worried about whether they themselves are going to survive, to be able to also find their way to having hope for the next generation and to help them imagine their own pathway to becoming parents. And that, I think, is the place where I'd like to turn to you, Brian Barkwell, and you, Larry Galbraith, to hear about your pathway to parenthood, maybe taking us back to a time in your lives when parenthood may not have even been an idea.
Yeah, yeah, definitely. First, I think we also want to start just by thanking you for asking us to participate in this event. We're both really happy to share parts of our journey with everybody. I think our journey started in 2011, and it was actually on our first date. And Larry told me that he was interested in having kids, which was a bit of a surprise, seeing that we just met, but it was not something I had ever envisioned for myself. But it was also something that I was open to.
They say that you should talk about these things early. I guess I just got wrong how early. But yeah, when I came out originally, in my early 20s, I had always assumed kids were just never going to be in the picture for me. I assumed as a gay man that it just wasn't going to happen, even if I did want it. But then one weekend, we went home.
Yeah, so we actually went to visit his family at some point, and we went up into the guest room, and on the couch was this pamphlet about surrogacy. And we were like, who put this here? So we went downstairs, and it turns out his dad had actually put it there for us. And he was like, I just thought it was something you guys might want to look into.
Yeah, very, very subtle, the grandparents asking for grandkids. So yeah, in 2015, we got married. Within a year or so, we started talking to others, like friends of friends who had gone through the adoption, IVF, and surrogacy processes. In 2017, we settled on IVF and surrogacy, that was the path we wanted to pursue. Within 3 months of attending a conference, we had found an amazing egg donor. We had met Dr. Pang. It took us a little bit longer to have children because we had some requirements for our surrogate in that we wanted her to be local. We live in Boston, Massachusetts. We wanted her to be local around Boston within an hour or so that we could be a part of the process, so that we could go to appointments with her and just watch the progression of this, this journey. And so our son was born in late 2019, just before the pandemic. And then our daughter was born through the same surrogate roughly 2 years later. And so now we're the proud parents of a 4- and a 2-year-old who are, amazing, sweet, lovable, and crazy.
Thank you so much. Such a beautiful story. There are some hard parts along the way, I think, that we've talked about. And, maybe I'm wrong about this, but maybe one of them is that moment before you realize that this could become your future where you're thinking it never will be. And I'm wondering sort of what it was like for you to be in that place. And the other hard part is that decision about adoption versus IVF, and both, what you may have gone through to make that decision and the kinds of things, supportive and not, that you might have heard around you.
Yeah, I mean, I think it goes, at least for me, like it goes a lot to show the progress that's been made in the last two decades. Like I said, when I was in my early 20s, and I just had this assumption that, I was going to maybe meet someone someday, but maybe be single forever, and that kids were just not going to be in the picture for me. I don't know if it was the same for you.
Yeah, it wasn't something I ever pictured. And I think when it comes to the choice of adoption versus surrogacy, I think for me, it just came down to having that desire and feeling that need to want to have that extra connection. But we have friends who felt just the opposite, who had that desire to adopt for other reasons.
Yeah, we talked to quite a few people who had gone through both adoption and IVF and surrogacy. And some of the folks that we had talked to had gone through adoption. There are pros and cons to both, but for them, they had gone through, in one couple in particular, had gone through adoption 3 times unsuccessfully, and then pursued surrogacy and was successful in having a child. And so I think for us, we decided to pursue IVF and surrogacy because it felt a little bit more certain. Now there are challenges certainly along the way and hurdles, as Dr. Peng can definitely attest to, and us as well. But that was just the personal choice that we made.
And we're in a no judgment zone, but part of the work of our center is to help people discover the judgments or assumptions they may be harboring that we can support people in letting go of. And I'm guessing that as you were thinking through your decision, you may have been confronted with various judgments around you, right?
Oh yeah, we definitely
Absolutely.
heard some criticism of us choosing to pursue IVF and surrogacy, but we also received a lot of support as well. Family members especially were really excited that we were going through this process. I mean, I talk about my dad giving us this pamphlet, and my mom, who is of Italian descent, the classic Italian nonna that wants these grandkids. They were ecstatic that we were moving through this process.
Yeah. And the people that may have been questioning our decision afterwards, after meeting our kids, after seeing the journey that we went through, their minds were absolutely changed. And they come out and they say so. They say, I don't feel the same way that I did before. Like, I see your family and I get it now.
So talk to us a little bit about what you began to allude to when you said there are some bumps along the way with IVF. And I imagine at the beginning, there's a lot of unknowns, a lot of uncertainties. So if you can talk a little bit about what some of those challenges were from the beginning through the process, and how Dr. Peng was able to help you through them, what he did, what he said, how he is. Because another thing we try to do at our center is to help folks reflect on what should care be like. What should we expect from care, and what can we aspire to for care? And I think for us, Dr. Peng is an emblem of how good care can get. But if you can help us break that down and tell us exactly what that looks like, that would be a great place to go.
Well, I think a good place to start is the fact that Dr. Peng was actually referred to us by one of my physical therapy clients who had actually been through the process himself. And he was singing Dr. Peng's praises. And he had also told us that Dr. Peng had been through a similar experience. So for us, that was huge. And then as far as when we started seeing Dr. Peng, I think the foundation that they laid for us was the fact that as much as this was going to be a beautiful journey, it wasn't going to be an easy journey. They told us that it was going to be long, that there most likely would be some obstacles, and they prepared us for those.
Yeah. And Dr. Peng and his team gave us examples of what they could be, but the list was certainly not inclusive of everything we faced. And in talking to other couples that have gone through a similar journey to ours, some of the challenges are the same, but a lot of the challenges are very, very different. And like I said, Dr. Peng can attest that every journey is different, and every challenge, all of these challenges that we go through, the only thing that's certain is that there will be challenges along the way. So his team really did prepare us for that and set us up, I think, for success. We felt better prepared in the beginning. And not just us, but our surrogate as well. This was a 3-way conversation that we were having. So for example, Dr. Peng's team set us up with a clinical psychologist to talk in the beginning about the process with our surrogate, to make sure we were all on the same page about things that could come up, obstacles, what kind of decisions might need to be made. And it just basically made sure that we were all working from the same playbook. And that's really important in the beginning of these, especially for surrogacy. It's really important you set this foundational baseline of trust with the person that you're working with, this really, really amazing woman. And that for us set us off on the right trajectory. I mean, our surrogate, like I said, has helped us with not just one pregnancy, but two. So we consider ourselves very, very lucky for that.
Yeah, absolutely.
So Dr. Peng, would you be able to mention maybe a couple of the kinds of surprises that can come up, just so people can get a sense of the kinds of things that you try to prepare people for, and maybe the things that you choose not to mention, but that you help people through when they do happen?
Oh, there's so many possibilities, but I'll just bring up a couple. One is a surprise in the fertilization rates or the embryo development, and we unexpectedly either get very few eggs fertilized, or none of the eggs fertilized, or none of the fertilized eggs grow into embryos that we can actually use. That's sort of one of the possible surprises that we get. And then, of course, not every embryo that we transfer will result in a successful pregnancy. And sometimes a pregnancy results, but then there's a miscarriage. So that's another surprise. So those are just a couple of very quick examples of things that we are not expecting, but definitely do happen. We've also seen situations where you line up an egg donor and something goes wrong and the egg donor situation falls through. Similarly, you line up a surrogate and the surrogate match goes through. I've had a situation where the egg donor or the surrogate, as they're getting ready to go through the cycle, she calls and says, "Oops, I'm accidentally pregnant. I'm going to have to cancel this process." Some of them either go on to have their own children, or some of them end up having a termination of the pregnancy so that they can come back and be the egg donor or be the surrogate. So all of these unexpected surprises occur, and it's just life.
And are there things that you're aware of doing as you help people through these ups and downs that you can share with us, so we can learn from you about your way of being that has created this kind of confidence and trust in people like Larry and Brian?
Well, as was previously mentioned, my husband and I have been through this process myself, and we have two sons who are 19 and 15. And our journey was fraught with surprises as well. And so I have a lot of empathy towards my patients who are going through this journey, because I know that there are things that can come up unexpectedly that, are very disappointing, that, seems to throw off the journey. But, we get back on the horse and keep riding.
Yeah, and you've ridden that horse all the way through your children's adolescence and early adulthood, and Larry and Brian are earlier on with a two-year-old and a 4-year-old, and there's
more to come.
Just
Just wait till your children are teenagers.
We'll have to have a sequel to today's conversation, so stay tuned. We would like to be there to celebrate that birthday. And with your 2- and 4-year-old, there's already so much going on in their minds. So tell us about the kinds of questions they may be asking, or you are thinking they may be getting ready to ask, or that you are preparing yourselves to answer the day that they do ask, about where this whole process and where they come from and how they were conceived and born.
Yeah, I mean, I think that we knew right away that we wanted to be very transparent and honest with our kids. We view this process as being really amazing and special and unique, and we want them to be proud of it. and we want them to know all the people that played a part in it. So it was important to us that they had the opportunity to someday meet their surrogate, to someday meet the egg donor, if that was something that they desired. So yeah, I think that's probably the biggest thing for us. That was really important.
Yeah, we had those conversations with all of the people involved right up front and said, you know, is this something that you would be open to? And the answer was overwhelmingly yes. We want our kids to know that there was an entire team of people behind bringing them to us, and that you know, like Brian said, that's special and unique, and it shows how much we really wanted to have a family, how much we really wanted to have them.
It also, you know, you both are such hopeful, optimistic, inspiring people. And there's a way in which your capacity for gratitude to Dr. Pang and this team of people seems like it's behind the way that you're approaching whatever questions your children might bring to you, and that you'll bring to them this mindset of hopefulness and gratitude. And it seems like as I listen to you, that will be, you know, central to how you answer all of our questions. But I'm wondering about when their friends start asking questions, or their friends' parents start asking questions, and some of that may or may not have already started happening. Are there things you're already hearing? Are there things that you're getting ready to hear, or friends of yours who are telling you, you know, this might be coming your way, if not now, soon?
I mean, I think as far as the process goes, people are definitely curious. I don't necessarily think that we proactively go out of our way to talk to people about it, but if someone asks a question, we welcome the conversation. And as far as I'm concerned, any question is a good question, because that shows a willingness that they want to learn about it. And for us, it's a bit of a teaching moment, I think. I think that I don't think that we envisioned ourselves as being representatives when this all started, but at some point it felt like that was sort of organically happening.
Yeah.
And I feel like we're both happy to kind of be in that role at this point.
Yeah, but I mean, it's so our approach with our kids and our approach of how other people ask questions is very similar. You know, we try and be open and transparent about it. Like Brian said, we try and we see people's curiosity as their willingness to learn about our family and how we had our family. You know, we're part of numerous online platforms and forums on social media, and everyone has their own approach to this. Some people don't like being asked the types of questions we get. You know, like a lot of the times we'll get the question, who's the biological father of who? And we don't shy away from answering that, but there are certainly some people that do. We're very upfront with people about how our kids were born if we're asked. And after, you know, we explain how we went through this entire journey to have our kids, people are overwhelmingly happy for us. They're really excited. And it's kind of goes back to what we were saying about adoption versus IVF and surrogacy, and people that may have been critical about our decision. They're once they see our family, it's what they see as a happy family. That's what is in their mind.
I also think that before having kids, maybe there may have been a little bit of worry about, you know, how our kids may have been viewed by their peers. But now, you know, Enzo is 4 years old. He is a very confident little kid. And all of his teachers do comment that he has leadership qualities. And I think that these things give us a feeling of, you know, feeling not really too worried.
Yeah, it gives us a
about
sense
how
of
that will
security.
be.
A sense of security. And that question, as an example you gave of who's the father. So was there a process you went through to get to the place where you're able to be open to and to see these questions as teachable moments? Was there a place where you were earlier, or you just like always generous?
I think we were always open, but you know,
Yeah.
it started from the beginning with our families mostly. When we said we were going through surrogacy, how are you going to choose who will be the biological father? Who is going to go first? There was a lot of those types of questions. And, you know, within our family, we already have this sense of trust. So we felt okay responding to those types of questions from the get-go. But then, you know, the questions started coming in from our friends as well, sometimes strangers on the street. But again, we view it as a moment like where people are showing a genuine interest in how we've had these kids. And the takeaway is always that they're just happy. They're happy to see these like two amazing kids with parents that love them.
You know, as I listen to you talking about your sort of inner circle of support and how that helped you be in the place that you are, to be open and ready to listen to these questions and respond in positive and instructive ways. I'm kind of wishing that this moment that we have together could kind of be part of that same process for people. Maybe that's too much to hope for, but we've got good people who are here with us. And we just had a question that I think is for you, Dr. Pang, from an anonymous attendee who writes, can you speak to the challenge to women to meet, in quotes, likely success criteria? In my experience, many reproductive endocrinologists won't work with women who are older, overweight, or have other barriers to carrying a pregnancy because it might negatively impact the practice's success rate. So that's a bit of a different path here, but I wanted to honor that question because I'm sure it is passionately felt, and not just by the person who wrote it, but by many.
Right. It is true that there are certain clinics who want to make sure that their statistical success rates look very good. And so they will have strict criteria about what patients they will accept for treatment. That is a true phenomenon. At Boston IVF, we do not have such criteria. The main criteria that we have in that line is for safety reasons. So in certain patients who have certain health conditions where it is maybe medically unsafe for them to go through IVF, we might say, no, we can't really do this. So for example, women who are obese beyond a certain BMI, there are anesthetic risks when we do surgery to retrieve the eggs. And given that we function in an outpatient office surgical center facility, we really can't risk having somebody have a anesthetic complication during the egg retrieval. And we know there are certain risk factors for that, where we would have to say, I'm sorry, we can't do this for you for medical reasons.
We have a comment also from someone who writes as a single woman who decided it wasn't fair to raise a child in a single parent home, which is, you know, a way that some people feel. I don't mourn passing on my own genetic legacy, but I feel an emptiness that no one is passing along my dad's genetic legacy. That was a comment that came in earlier. I think that was a way of speaking to the importance of what you're able to do for so many. And that brings me to, I think, where we wanted to be sure to take this conversation as well, which is what would it be like without IVF? Because we know there are currently threats to these reproductive technologies. So what would our world be like if we had that right and lost access to IVF taken away? And that's for you, Dr. Pang.
Sure. So in order to understand what life would be like without IVF, we would have to go back to pre-1978, before IVF was done and was successfully done. And back in those days, couples who had infertility had very little in terms of medical treatments that were successful. Many of them, for example, Louise Brown's mother had blocked fallopian tubes, and there was no way that she could have gotten pregnant without IVF. The only way that she could have had children would have been through adoption. And using another example, men who had very severe sperm problems, who could not get pregnant the usual way with, just sexual relations, would have to use donor sperm to have children. Women who had, genetic diseases, we would not be able to help them select embryos and not pass on the genetic disease to the offspring. And they would have to use donor eggs, for example. And even then, donor eggs would not be something that we could use without IVF. So it really would limit what options people have. And many of them would either end up with adoption, which is an alternative to building their families, or they can also end up living child-free without children. And many couples who faced infertility pre-1978 just ended up living without children. They had to accept that as a fact of their life and go on.
We have another question for you. What kind of financial assistance is available for IVF? This always comes up. I am not making a recommendation. I do know someone who took out a second mortgage on their house to be able to do this. But tell us if there is and what kind of financial assistance there might be for IVF or insurance coverage.
Sure. Currently, I believe there are about 17 or 18 states in the US where there is a state law mandate for coverage for infertility treatments, some including IVF and some do not. So there are many states in the US that do not have this mandate. And so people in those states have to come up with the funds to pay for it themselves. And yes, if they don't have the funds, they can take a second mortgage, they can borrow. There are medical, how shall I put that? Companies that specifically make loans for medical treatments that they can borrow from. There are some patients who get funding from family or friends. I certainly have had many same-sex male couples, for example, get funding from their parents who want grandchildren. So yes, there are many different options, but it is still a major challenge. And hopefully there will be a federal law that eventually passes that mandates all health insurance plans to pay for infertility treatments up to and including IVF.
So that I think leads us to where we'd like to land today, which is what is your call to action? What would you like to see us all do? And maybe we can start with you, Brian and Larry.
Yeah, I mean, I think for the folks on the phone who are healthcare providers and people that would be working with families like us, our hope is that you hear our story, and when you meet someone like us or a family like us, that you understand how badly we wanted a family and kids, and the steps that we had to go through and the journey we took to get there. And so I think from our perspective, we're really hoping you can take that and apply it to your own patients and clients and people that you may meet outside of work as well.
Yeah, I couldn't say it any better than that.
Thank you. And what about you, Dr. Peng? What is your call to action for us, and how can we all be a part of this movement?
Right. You had mentioned earlier that there are a lot of threats to IVF currently with the Supreme Court overturn of the Roe v. Wade and the Dobbs decision that has had unintended consequences and is leading to multiple threats to IVF. And even before the Dobbs decision, in multiple states, there have been local state efforts to assign personhood to embryos, and that would also threaten IVF. So I would say that, people should advocate with their legislators, both local state legislators as well as federal legislators, to provide protection to IVF so that we can continue doing IVF and helping families build their families with IVF.
So tell us how worried you are or how hopeful you are about whether we're going to go backwards or whether we're going to be able to go forward.
Well, I really would hope that we will get into a situation where we don't go backwards. We don't want to go back to pre-1978. We want to go forward and make IVF accessible to all people, including LGBTQ people, and all people who currently don't have insurance coverage. We want to go forward in that direction. We do not want to go backwards to where IVF is not available or becomes prohibited by law and have to go back to pre-1978. We don't want to go backwards. We want to go forward.
And as we go forwards, I am hoping that we will have another another birthday to celebrate with you at some point, and that you will let us all know. And in the meantime, do you have last words of wisdom, parting words for all of us, Brian Barkwell and Larry Galbraith?
I think we take a lot of solace in seeing, not only seeing the change that's happened in the last 20 or so years, but also living through it. For our family, our son goes to school and he's in school with kids with two moms, kids with single parents, kids taking care of grandparents. Helps reinforce the message that every family is different, every family is beautiful. I can't imagine when I was growing up the impact I would have had seeing another schoolmate or friend with two dads or two moms. That would have been really, really, really positive on me, or had a positive impact on me. So I think, I'm happy to see that the progress has come to where it is, and I hope that we just continue to see it move forward.
Yeah, and we're incredibly grateful to Dr. Peng and his team for helping us, and we really hope that the opportunity for other people continues to exist.
Well, we are incredibly grateful to you, Brian Barkwell, Larry Galbraith, and to you, Dr. Peng, for sharing your story and your work with us today, and for all that you do. And we are grateful to everybody who has joined us today, and to everyone who will listen to this again on our YouTube channel, for all you do for children, and as you've just reminded us, for all kinds of families. Thank you all for joining us today for this first episode of Learning to Listen for Fall 2024. And we hope you'll come back on October 23rd to listen to Julia Olson Attorney Julia Olson is co-executive founder and director and chief legal counsel of this fabulous organization called Our Children's Trust. And she'll tell us how she partners not only with health professionals, but also with children to stop climate change and to protect children's rights to a future on a habitable planet Earth. Again, thank you, Larry Bryan and Dr. Pang, and thanks to all of you for all you do for children in all kinds of families.
It's been a pleasure. Thank you for having us.
Thank you.
Thank you.